What happens if physical therapy doesn't help? When PT fails, well then what? Well, hey folks, I'm Dr. Jeff Williams with Creekstone Integrated Medical, and I strongly encourage you, think about your loved ones here. Are any of them facing surgery for their back, neck, or joints? And if so, please send them this video, especially if they went to a physical therapist and it hasn't helped. So sharing this video with them can absolutely prevent a lot of issues for them down the road. Trust me, every week we see those that didn't have this information before they got surgery. Now, for this discussion, I'm just going to talk about non-complicated musculoskeletal issues, okay? No tumors, no post-surgical recovery, no stroke recovery, nothing on that level. Think more along the lines of back pain, knee pain, shoulder, neck pain, something on that scale. Now, if you've had experience seeking medical treatment for pain of this nature, then you're probably familiar with the referral to physical therapy. Physical therapy has been able to position itself as the very first referral for non-complicated musculoskeletal pain in the eyes of the medical profession and medical providers. Now, I could go on for hours about why I believe chiropractors are not considered the first referral, but I'd get way too far off topic. So we're going to get back to the point. Physical therapy is highly valuable, performed by highly trained and very educated providers, and can really make a big difference in people's lives. Let's be honest though, not everything is a silver bullet. Lots of times, physical therapy does not resolve the pain. Heck, surgery for these types of issues has a pretty miserable success rate. Pain is just difficult to say the least. Usually you need a broad approach, and one single thing usually doesn't do the trick. Especially pain that has been allowed to hang around and be an irritant for an extended amount of time, right? Now, because pain can be so difficult, I'm careful to counsel patients and let them know that just because PT fails, it doesn't mean that PT or exercise can't help them. Just because a chiropractor didn't help them before, it doesn't mean that chiropractic cannot help them. It usually means that you needed a change in scenery. You needed a different provider. Not all providers are created equally, and not all patients are perfect fits for the specific talents that a specific provider can bring to the table. So keep this in mind. Should you find yourself trying to avoid surgery, you got to keep this stuff in mind. If you're not getting out of pain, a change of scenery may be just what the doctor ordered. Now, within the typical medical procedural code, I guess, when a patient fails PT, there's not a lot of time before things start accelerating and treatment gets escalated. Patients are not typically moved to a different PT in a continued effort to avoid escalating things. Insurance covers typically one round of PT, and should that round of PT not be effective, the patient is then sent to one of two places. The first one being pain management, which might include potentially dangerous and addictive medications, burning or cutting nerves, implanting devices that may help deaden pain, epidural spinal injections, and things of that nature. The other place that they commonly get sent to when PT fails is surgery. Surgery, or at least a surgical consult. And surgery has a terrible success rate when it comes to more simple musculoskeletal pains because pain's difficult. And surgery's permanent, folks. There's no going back. In addition, the American College of Physicians recommends surgery as the very last resort. After spinal manipulative therapy, after exercise, massage, acupuncture, yoga, cognitive behavioral therapy, and some other recommended first-line treatments. After all of those things have been tried and failed, then you consider surgery. And it happens a lot out of order when surgery should have been the last resort. Many times it's the first resort. Now, these are the most common next steps. But are they the most responsible or the most appropriate next steps? Well, what if it's your mother or your sister or your child? What would you like to see happen if PT is not immediately helpful? Would you like to see them try other forms of safe, non-invasive, non-pharmacologic treatments? Of course. Wouldn't you prefer your family member or best friend avoid surgery if they can? Of course you would. This is where an evidence-based chiropractor can absolutely change the game. The majority of what the American College of Physicians recommends as first-line therapies for back pain is available right here at Creekstone. These include spinal manipulative therapy, exercise, massage, low-level laser, low-level medication, and acupuncture, all right here in one spot. And when PT fails, there are lots of options left instead of direct referrals to pain management or surgery. When PT fails, a broad management protocol like is found here at Creekstone Integrated Medical can usually step in and flip the script, getting the patient back on the track to less pain and more life. And this improves the lives of our patients on many levels, including more sleep, better relationships with their loved ones, more quality time spent doing the things they love doing, and more overall productivity. And when you feel better, you feel like doing more. When PT fails and you're not ready for pain management or surgery, call us at 806-355-3000. Let's get you taken care of. Less pain, more life. If you're watching us on Facebook or YouTube, please share with those that you know that need this information. It's super important. With your help, we can get them taken care of too. Until next week, I'm Dr. Jeff Williams. Stay smart, and we'll see you then.